Hello all, welcome to yet another session of our PhysioTV. I am Dr. Vaishnavi More, who is pursuing NPT in neurophysiotherapy in Sancheeti Institute for Orthopaedic and Rehabilitation, College of Physiotherapy. Today we are going to discuss about outcome measures for assessing balance. Now, in our day-to-day life, we all see many musculoskeletal injuries as well as some neurological injuries, which affect the balance of the uh, person or a patient. So, assessing or evaluating the balance by the examiner plays a very important role in managing or treating, planning for the management of the person or the patient. So, yes, today we'll be looking for the outcome measures, the quantitative outcome measures for assessing balance. So, um, yeah. Firstly, looking into the balance. Balance is the condition in which all the forces acting on the body are balanced in a way that the center of mass is within the limits of stability, the boundaries of the base of support. So let's start with our outcome measures of the balance. So today we are going to see all the outcome measures which are being used for assessing balance, being the widely used methods or some of the advanced. We'll also see some about some advanced outcome measures which can also be used in assessing or evaluating a patient for the balance. So, firstly, we'll be saying Berg balance scale. This is one of the scale which is very widely used. This is used for objectively determining a patient's ability to safely balance during a series of predetermined tasks. So, this scale is basically a 14-item scale. So, it involves sitting balance, standing balance, and also some static components as well as dynamic components. So, here we can say that all of the components of the balance are being assessed. So, and therefore, this is one of the scale which is being used in elderly population or geriatric population is also being validated in many n number of neurological conditions for assessing the same. Here we have a scale, 5-point ordinal scale, ranges from 0 to 4, with 0 indicating lowest level of function and 4 indicating the highest level of function. So it approximately takes 20 minutes to complete the scale. Yeah. So herein we can interpret the scale as in the how much the patient is being for the risk of fall. So 41 to 56 is a low risk of fall, as 56 is the maximum score of the scale. 41 to 56 is a low risk of fall. 21 to 40 is medium risk of fall, and 0 to 20 is the highest risk of fall. Moving on to the next key. This is a dynamic gait index. So dynamic gait index tests the ability of the participant to maintain walking balance while responding to various demands through various dynamic conditions. It includes 8 items: walking on level surfaces, changing speed, head turns in horizontal and vertical direction, walking and turning 180 degrees to stop, stepping over, around and around obstacles, and stair ascend and descend. So the person or the patient is exposed to various environmental conditions, and so is being assessed or evaluated by the examiner for the same. Now, here we have each item which is scored on a scale of 0 to 3, where 3 is indicating normal performance while 0 is representing severe impairment. The best possible score of this is 24. And according to the research, this DGI has been shown to have high reliability. Also, evidence shows the concurrent validity, good concurrent validity with other balance and mobility. Okay. So we saw both balance scale with static as well as dynamic components. DGI is also one of the scale which involves various environmental modifications and then assessing the person accordingly. Moving on to the next scale, which is timed up and go scale. So this is called as TUG. So this is used to determine fall risk and measure the progress of balance, sit to stand and walking. So herein there are various components which are being assessed. This scale includes various equipments like a chair, 3-meter walking distance, and this is a scale, whereas the outcome measure which is used is time. So time is the component, or the duration of time required to perform the specific task is being evaluated or examined by the examiner. So the time starts when the person or the patient is rising from the chair, standing, then walking forth and back, taking a turn, then coming back and sitting on the chair. And that time is being recorded, and that is being used as to assess or evaluate according to the age group. So this is one of the very simple screening tests that is sensitive and specific enough to measure probability of falls among older adults. So there is a lot of research done in this scale in the elderly or a geriatric population, and is being widely used for evaluating the risk of fall, because this scale not only assesses balance but also gauge reaction time. So a lot of components are being assessed at the same time. Yeah. So the recent study published in 2022 found that TUG test is a strong mortality predictor, displacing other established risk factors such as chronic diseases in geriatric population of low and middle income countries. So here, various population, the decades of population has been assigned, has been given a normal value. For example, in normal adults, if we see, less than 10 seconds is a normal time required to complete this task. Anyone requiring more than 10 seconds is considered to have a risk of fall. Also, the geriatric population or the older population has different normative values for the same. Moving on to the next scale, we have functional reach test. Now, functional reach test is one of the clinical outcome measures and assessment tool for assessing dynamic balance in a very simple task. So here the patient has to stand closer to the wall, and the main precursor here, or the main important feature the patient should be able to do, is shoulder flexion up to 90 degrees. Then the person, the subject or the patient has to reach maximally forward possible using only his trunk and hand. The person cannot step forward while going ahead with his hand. And herein we assess the uh, distance from the initial to the final. So the difference between that is being noted or recorded by the examiner. So yeah, the patient is instructed to stand next to, but not touching the wall, not using any support, and position the arm that is closer to the wall at 90 degrees of shoulder flexion, and is assessed accordingly. But herein we assess the forward reach of the person, and is being again is being evaluated according to the normative reference values, which is different for each population. So this scale is being found to be validated in pediatric population now as well, and adult as well as some neurologically impaired population also can be used. Moving on to the next scale, which is multidirectional reach test. Now we spoke about functional reach test. But how is this different than the functional reach test? It comes with the name. Functional reach test is only going to assess the forward balance, anterior posterior balance, and this multidirectional is assessing balance in all the 4 directions. So here we are assessing balance in anterior direction, posterior direction, right lateral direction, and left lateral. This is found to be a very inexpensive, reliable, and valid tool for measuring limits of stability in all the 4 directions. Now, the procedure is similar to functional reach test, just that the limits of stability is assessed in all the 4 directions. It's the only modification of the test, but it is found to be valid and clinically reliable in n number of populations, being it a older population, elderly adults, where we have to assess their balance, or a pediatric age group involving typically developing children, and is also found to be valid in Down syndrome. Yeah, this is we saw about work balance scale, dynamic gait index, then functional reach test, multidirectional reach test. Now coming on to the Y balance. A Y balance test is a simple and reliable test to measure dynamic balance. Now, how is it different than the other scales which we saw? We look on to the procedure here. The patient stands on one leg while reaching out in three different directions with the other lower extremity. So the person performing the test is going to stand on his one leg, and here the tapes are measured accordingly, where the person has to go anteriorly, posteromedially, posterolaterally. So three different directions are being assessed here. So here we are not only assessing the balance, but also flexibility and strength is also being assessed while performing this test. So this is one of the very important and research test which is used in athletic population, and is also one of the guide for return to sports activity in the athletic population. So there is a lot of research which is where they have used it in a number of athletic population. It is a sensitive indicator of injury risk among athletes. So here it assesses three different directions using lower extremity. Functional reach test and multidirectional we saw with the limits of stability within the base of support. The person is not taking a step ahead, but here the person is not using his upper extremity. One of the important instruction here becomes the patient has to keep his hand on his hip. So no, not using upper extremity, only directional change and reaching maximally with his foot to the according to the tape. So whenever the person is at whichever point the person is touching the tape is being marked, and it is being measured, and then it is compared to the normative reference value. So this is one of the tests which is also being widely used in a population which we spoke about. Next, we have star excursion balance test. This star excursion balance test, or SEBT, is a dynamic test that requires strength, flexibility, and proprioception. So not only assessing balance, but various aspects of the other important measures. It is a measure of dynamic balance that provides significant challenge to the athlete and physically active individuals. Now here, the goal of SEBT is to maintain a single leg stand on one leg while reaching as far as possible with the contralateral leg again. But if you could see in the picture, we have the tapes are being arranged accordingly with n number of directions. So here, the person is performing the test with 8 different directions. The person performing the test must maintain their balance on one leg while using other leg. The person has to reach as far as possible in 8 different directions. Okay. So the 8 different directions being anterior, anteromedial, medial, posteromedial, posterior, posterolateral, lateral, anterolateral. So these are the 8 different directions wherein the person is performing the test. The instructions which we saw in white balance test are the same applied over here. So the person has to stand on one leg and reach with their toe maximally as far as possible. So wherever the toe or the foot is touching, the point is being marked for the person, and then it is being measured in all the 8 directions. So this was assessing a lot of 8 different directions. We started with the functional reach, which was assessing only one direction. Then 4 directions. Y balance was assessing 3 directions, but with a lower extremity. And this is a star excursion balance test, which is assessing 8 different directions. This is also one of the measures which is being assessed by the for the athletic population as well. Yeah. Till now, we have seen a lot of outcome measures which are being used for the population, which are being widely used and accepted in all the clinical settings, rehabilitation setups. So these are one of the things which are used normally. But now we are going to see some advanced equipment which are being used in some places, and also a lot of research is going on in that equipments also. So today we are going to briefly discuss about computerized posturography. Now, what computerized posturography is? It includes a force platform. So the force platform is something which has some sensors which is going to assess any change, minimal change in the or minimal shift of the center of mass within the base of support can be assessed. There are various advantages, various uses of this platform and this computerized posturography, which is being taken care by a device. So this is one of the very advanced equipment which has been used for evaluating also for training of the subjects, normal individuals also, and some musculoskeletal injury patient with a musculoskeletal injury, as well as some neurological ill population. So there are various computerized posturographical equipments which are being researched a lot. We speak a lot of equipments like Neurocom Smart Balance Master, whereas and also about Biodex Stability System. So these are certain names of these equipments which are being used. Today we are going to discuss about one of the equipment which is GIA Master. This is the equipment which consists of platform which allows us, which with a single device is used to evaluate and rehabilitate a person. So here in the figure you can appreciate this device. This is a force platform which you can appreciate, which includes the footprints where the person has to put the both the feet accordingly. This is a patient's display where patient gets a visual input, what is to be done, how is he being performing. So it is a patient's visual feedback. And here laterally we have a operator's display. So this is something which is concerned for an examiner to evaluate. So it is called as operator's display. So herein the patient is positioned accordingly and is being assessed. Now, as we all are aware that balance not only includes, it includes three different systems. One being visual system with the visual input. Secondly, proprioceptive input or somatosensory input. And thirdly, we have vestibular system. So the receptors of these all systems take care of a balance component. So these three all together are being taken care by this computerized posturographical equipment, because all the three assessing with all the outcome measures which we have discussed is little difficult. So this becomes an advanced tool for assessing the thing. Now, this is one of the equipment which allows the balance system to be fully stimulated by the triple function. So the platform which I mentioned earlier, it is static, passive dynamic, and active dynamic. Means static being the person is in the same movement. There is no shift of any movement there by the platform. And passive dynamic, there is the movement, a dynamic movement by the equipment or the machine. But and thirdly, we have active dynamic, which means the machine is going to move wherever the person is going. So the active movement by the person also, and the equipment is moving. So the platform which we discuss is not only static component but also plays a vital role in a dynamic component to tackle the dynamic components of the balance. So when we saw the three different functions of the platform, it also includes the platform with a additional foam padding. So why foam padding again? As we there is one of the systems, somatosensory system, which gives us the proprioceptive feedback for balance. So this is one of the equipment part of the equipment we are using to tackle or to challenge that particular system and then assess the balance of the same. So herein we have the additional foam pad to assess the balance. Yeah. So this not only is used for assessing static and dynamic components of the balance, but also gives different results for the person with eyes open and eyes closed. Moving on to the next component of the scale, this is how the assessment display or the operator's display looks when we are assessing the person. Maybe we could assess the user difference simple test for limits of stability of the person or the patient. So the person will be standing on a stable surface, and the instruction by the examiner would be reach as far as possible anteriorly, then laterally, right as well as left, and then posteriorly. So we are assessing limits of stability. We are shifting the center of mass within the base of support, but we are assessing how much the person can go for seeing the capability of the person. So we could assess, so we could plan the further management for the person. So any minimal detectable shift of the center of mass is being recorded by the equipment. So any change is being recorded over here. So there are different parameters which this device is going to record. There are values of XX, if you could see, and YY. So XX being the lateral displacement of the person, while YY being the antero-posterior displacement of the person. So these are the different axes where the values are being recorded and which we should use as a component for assessing or the outcome measures, quantitative outcome measures for our assessment. So it portrays or displays maximum X, which being the maximum the person has reached in maximum X being laterally. So maximally reached laterally or maximally reached anteriorly, which will be maximum Y. So maximum values are being shown, minimum value. So minimum Y is used. X being the average of the value, Y being the average of values of anterior posterior. Okay. So these are being shown in the specific device. We also get here the normal parameters of the values. You can appreciate here the with eyes open also and with eyes closed. So here the values are being given in mm. So millimeters is being used for the particular parameter. So yeah, this was about the display which we can see and appreciate and use for evaluating our patient. This is another view for the operator's display, that which means the this is the placement of the foot, and the red line which we can appreciate is the shift of the center of pressure from the direction of the shift and how much the shift is, that is being given with this red line. So X average being again the mediolateral displacement, which is again given in mm, and Y average being the lateral displacement, which is also given in mm. And here we can appreciate in which direction the person is moving while is being instructed to do so. Yeah. In the second figure, we can appreciate, you can see the graphs which are there. So there are two different graphs, and these graphs are called as stabulograms. This is a stabilometric test which we are discussing. So the stabilogram. So there are two different colors. The first is a red graph, which is showing the lateral display. That is the X part. Okay. So this is the red one is a lateral displacement, and blue one which we can see is a anteroposterior displacement. So and also if you see there is an orange line which is called as a trend line. This is a trend line which is showing or depicting the normal average movement which is been going on for the person. So both of them are the trend lines, which is the average movement or the center of pressure movement of the person we are evaluating. Here also you could see the value, the velocity while performing the movement, the mean average values for the displacement of the seat. So this is how we can get a graphical picture of our test, and they are showing or depicting the maximum and minimum values are of our movement of center of pressure. Yeah. So as we discussed, how the tests are going to be, there are different components of the test: eyes open, eyes closed, eyes open with a foam pad, eyes closed with a foam pad. So various different devices shows various different components of assessing the balance. Also, firstly, we spoke about the test of balance, and these the three different systems which are being involved. So three different systems which are assessed is called as the test of balance here. So the test of balance is three inputs: are visual input, vestibular input, and proprioceptive inputs, and they are accordingly indicating the percentage while performing the test. So visual input being 10%, vestibular input being 56%, and proprioceptive input being 34%. This is how it has been shown to the patient, so that that is being easily understood by the person. Also, they show the normative values for each person. Also, these devices are using the all the demographic data of the person, including height, weight, shoe size required by the person, and according to the age, weight, BMI, the normative reference values are being used, and thus we can see the report of the person in this format. Yeah. So this was about the some advanced equipments which we spoke today was GR Master. So various components are also there for assessing balance. So yeah, thank you so much. I thank Dr. Parag Sancheti, sir, chairperson Sancheti Groups, Manisha Sangvi ma'am, chairperson Sancheti Healthcare Academy for their constant guidance, our principal Dr. Apurva Shimpi sir for his guidance, our PhysioTV technical team, and all our loyal viewers. See you in the next PhysioTV.